good morning, everybody. Thank you, Ed, for having us here today. This independent pharmacy is one of those institutions in a place like Waterbury where they've been open for almost 40 years. And it's a place that many residents rely on for getting the drugs that they need, but also the advice that they need when it comes to drugs. And as Ed just said, we have an affordability crisis here in Connecticut and across the United States right now when it comes to prescription drugs. The prices are through the roof. 1 in 4 members of our state says that they have thought about not getting the drug that they need to survive because they can't afford it. And that is just unacceptable to me. It was unacceptable to the governor and my colleagues that are here today in the legislature, which is why last session they passed a bill that allowed my office to join an interstate collaborative called ArrayRx that is enabling us to be able to offer a drug discount card called the ArrayRx Drug Discount Card to every single resident in our state, regardless of how old they are or where they live, or frankly, even what their immigration status is, to download that card right now at ArrayRxCard.com and use it at a pharmacy like Stoll's here and 98% of the other pharmacies here in the state of Connecticut. And we launched this card on October 1st of last year. And I'm proud to say that in the first 3 months of us having this card out to the public, we've had over 15,000 people sign up for it. And the average savings, which I'm announcing for the first time today, in that first 3 months for each person that is enrolled is $203. And so we were talking about this earlier, the mayor and I, that when you're on a fixed income or you're the kind of person who's been making that terrible choice between eating and paying the rent and getting that drug, that $200 of savings is a game changer for you and your family. And that's why really we're here today in Waterbury, and I've been traveling around the whole state to let folks know about this. So while it's great that 15,000 people have signed up, we have 3 million people in this state. And there are many, many, many more people out there in cities like Waterbury, in communities all across the state that could benefit from this. And I'm so excited to be joined today by some colleagues and friends who are helping us spread the word about this. But again, this is a quick, simple, and most importantly, free resource that every Connecticut resident can download right now and then use at a pharmacy like this or the pharmacy of their choice. They can even use the website, ArrayRxCard.com, to look up the cost of their specific drug at a specific pharmacy that's located by them, and they can check out the price there. And again, this is something that everybody can benefit from, and we're asking everybody to at least download the card, give it a shot, and keep giving it a shot. Even if the first drug you try to use with it is perhaps not any different than the price it would be if you had insurance, then I would ask you to give it a shot and keep using it. Last thing I would say is there are 3 specific kinds of people that really benefit from this card, and I think it's important to go over what they are for the folks that are here today from the press. Number 1 are seniors. A lot of folks think that because seniors have Medicare that they have no problems when it comes to drug affordability. That's actually not accurate. There are many drugs that Medicare does not cover, and I have heard great stories so far just traveling around the state of people saying, I'm on Medicare, I thought I had great insurance until my doctor prescribed a certain drug for me, and I realized that that drug was not covered, which obviously costs somebody who's on a fixed income a lot more than they had been budgeting for, simply because they're on a new drug. So seniors is the first one. Number 2 is folks that are uninsured or undocumented, people who don't have any sort of insurance whatsoever and come to pharmacies like this one asking for help. I was raised mostly by a single mom. My mom ran a small business. She almost never had health insurance when I was growing up. And I remember her putting off doctor's visits, putting off going to the pharmacy. But when she really had no choice but to get a drug, I remember vividly being in the Guilford CVS with her as she would try to talk to pharmacists like Ed to say, hey, I really can't afford this. Is there another drug that I can take? People shouldn't be having those conversations, and far too many people in our state are still uninsured. And then there are folks that can't have insurance because of their status. This card is free and open to them and can be used, again, for a supplement if they don't have insurance. The last group are people who have high deductible health plans, something that is a very common thing nowadays because of the way in which people are getting insurance. Typically, 30 years ago, if you got insurance, it was from your office or your job. Most people get their insurance through their job. The companies were paying larger shares of the premium for their employees. Now, because healthcare is so expensive, these businesses can't afford to do that anymore. And that has led to a rise in these high deductible health plans, which mean that you have to spend sometimes hundreds, if not thousands of dollars, even to begin having insurance. This is a tool for those people as a way to save before the insurance kicks in on that high deductible plan if they have not yet reached their deductible. So all in all, this is a tool in the toolkit for the people of Connecticut. We're just asking people to give it a shot, download it, and use it at pharmacies like this one to save on the cost of your drugs. We know that the overarching things that are causing those drugs to be expensive are things that my legislative colleagues or former colleagues are going to be working on to try to drive down the cost of drugs. It's something the governor and I are actively working on. But until we get to bigger reforms, this is a great way that people can save right now, today, for free on the cost of their drugs.